Hello and welcome. I'm Dr. Stacy and you're watching Health Mantra, a special program brought to you by Manipal Hospitals, Goa, where doctors from various fields of expertise come and share their views on various health topics. With me in the studio is Dr. Madhav Sanzgiri, a consultant urologist at Manipal Hospital, Goa. Dr. Madhav, welcome to the show.
Hi, thank you very much for having me here, Stacey.
Yes. So, Doctor, tell us a little about yourself first and what is urology?
I am Dr. Madhav Sanzgiri. I am the Chief Urologist at Manipal Hospital, Goa. I have qualified in urology from Mumbai and studied in UK afterwards. And for the last 21 years, I have been practicing as a urologist in Goa. In Manipal Hospital, we have set up a extremely ultra-modern urology department with all the latest technology and expertise. And the field of urology has undergone a lot of changes and advances in leaps and bounds in the last 10 to 15 years. And we have managed to keep abreast of all the technology, and we carry out quite a few high-end advanced procedures now at Manipal Hospital, Goa.
Right. So, Doctor, as you said that technology has grown so much in various fields. So, what is the latest technologies that we have adapted in urology at Manipal Hospital, Goa?
Basically, the technology has and expertise has advanced to avoid more severe interventions in patients needing all these treatments. So the focus is on minimally invasive treatment where there is no need for major anesthesia, no need for any operative scars, no need for too much pain, and treatment of pathologies with minimum morbidity and complications. So the entire focus on technology is towards achieving the aim of minimal invasive methods and excellent results as far as recovery and the patient going back to his normal life as fast as possible.
Right.
So at Manipal Hospital Urology Department, we have a dedicated operation theatre. We have the absolute latest technologies from reputed companies like Siemens, which provides us the latest image intensifier. Olympus Technology Systems have come up with one of the latest endourology endo-camera systems, and we have recently actually installed one of their latest technologies, and it would probably be the first installation in the entire country. We also have excellent flexible endoscopes, that is flexible cystonephroscope and uretroscope from Olympus, and combined with the holmium laser, which is now the latest technology for fragmentation of kidney stones, laserizing strictures or any narrow areas of the urinary passage, and in some special cases even ablating cancerous tumors. We also have the latest Dornier extracorporeal shockwave lithotripsy unit, which is basically treatment of kidney stones in suitable cases by extracorporeal shock waves, which is without anesthesia, done as a daycare procedure where patient does not even need an IV line, doesn't need any antibiotics, and the treatment is absolutely painless and no scar at all. So we have adapted all these technologies to our practice, and it is giving us excellent results in terms of treating the pathology as well as getting the patient back to a normal active life as soon as possible.
Right. Now, Doctor, as you said, there are so many different procedures with the advance in technology. So what is retrograde intrarenal surgery?
Retrograde intrarenal surgery is one of the latest subspecialties in endourology. Basically, very, very fine and flexible endoscopes are used, which can be passed through the natural urine passage right up to the kidney and into every single corner of the kidney. The kidney being shaped in such a way that a straight and a rigid endoscope would not access all the various parts of the kidney.
Right.
So this endoscope actually enters the kidney and bends into every single nook and corner of the kidney, because the kidney is the nooks and corners are almost like caves. You have to enter each cave and treat the pathology. And this technology mainly is used to treat multiple stones which are there in various different parts of the kidney, and it can be done in combination with the holmium laser. So the technology is extremely good, painless, does not need major anesthesia, and a large number of stones in different areas of the kidney can be tackled in one sitting, and in one admission we can render the patient stone free.
Right. So, doctor, what is narrow band imaging, like you said earlier?
Narrowband imaging is also another latest technology by Olympus Medical Systems, where we have now installed that endocamera system in our unit. Traditionally, all endoscopies use white light, and this technology is specifically for detecting small bladder cancers or bladder cancers which are in the very initial stages. So, white light cystoscopy may not reveal these tumors very clearly. Now the technology has been adapted so that the white light is now modified by optical enhancement and splits into blue and green light. And the areas of the bladder where there are tumors, they usually have an increased blood supply. So they appear in a highlighted fashion, either in brown or green color, because of the presence of the blood pigments in that area. So this helps us pick up tumors which may not be necessarily and easily picked up on white light, and it has helped us pick up cancers in a lot of patients where they would have been easily missed, because since they are very small tumors in the early stages, symptoms haven't come, they are not even picked up by the CT scans and MRI scans. And on an endoscopy, we have picked them up and even treated quite a few.
So it helps to detect cancer much earlier.
Much earlier, and the technology is very, very useful for this purpose.
Right. So, doctor, I am given to understand that kidney disease is broadly, divided into acute and chronic. And chronic kidney disease, I think at stage 5, where there is end-stage renal disease, the treatment is mostly based on dialysis, and the other option, of course, is transplant. So, what is the kidney transplant program all about at Manipal Hospital, Goa?
So basically, chronic renal failure is where the patient's kidneys have failed and are not doing the normal functions, as a result of which there is a buildup of all metabolites, mainly very high serum creatinine, and it leads to various consequences on multiple systems, and the patients become very unwell with fluid overload, bloating, nausea, vomiting, loss of appetite. And in very severe cases it becomes life threatening and patients end up in the ICU. So basically we have to institute renal replacement therapy, which is in two parts. One is where we can do dialysis, where all the metabolites which are toxic metabolites which are accumulating are extracted out of the body either through peritoneal dialysis or hemodialysis. But this is just a temporary solution. In terms of finding a definitive solution, kidney transplantation is the single most definitive way to treat these patients. Kidney transplants are again of two types. One is a living related kidney transplant and a deceased donor program kidney transplant. So at Manipal Hospital we have established a very robust kidney transplant program. We have done living related transplants so far, where a patient's relative donates to the patient after going through a very rigorous process of testing, finding the correct blood group match, HLA typing, getting all the necessary legal documentations and permissions. Each case is then sent to the health department authorizing committee of the state, and once they give us the proper approvals, we proceed with the transplants.
So, doctor, what is special about the kidney transplant programs at Manipal Hospital, Goa?
Donating one's own kidney to a relative to save his or her life is one of the most selfless acts a human being can do. It is one of the most difficult things to do, and it is really important that we appreciate the sacrifice that the donor is making. And it is our duty to make his life as comfortable as possible in this process. So traditionally, transplants, donor kidney retrieval was done by an open surgery for several years, and it's still being done by open surgery in a large number of places. But we have adapted the latest technology and expertise here, and we do a laparoscopic kidney donor retrieval, where the kidney harvesting is done via keyhole method. The main advantages for this are that the patient does not have any ungainly scars. Patient has very minimal pain. Patient is up and about the next day, and we discharge our donor on the third day. So the patient goes through minimal pain, has a safe experience, and is getting back to active life within a week of his donation, which was not possible with the open methods. So this is unique to our program at Manipal Hospital, Goa, and we are hoping that it would benefit many more patients in the future.
Right, doctor. Doctor, what is nephron sparing surgery? And before you explain that, I think it would be nice if you tell our viewers what exactly is a nephron.
Yeah, nephron is the unit of the kidney. It is the single functional unit of the kidney. So the kidney is made up of several functional nephrons. Now, with the high incidence of medical diseases like diabetes, hypertension, polycystic kidneys, and certain other disorders, there are patients who are prone to chronic renal failure. Now, nephron sparing surgery was attempted in a with the aim of saving as many nephrons as possible. So this is a technology which is used basically to treat kidney tumors. Now, in the past, any patient with a tumor in the kidney had the option of only removal of the entire kidney. Now, there are some patients who have only a single kidney for various purposes, congenital, or have had the other kidney removed for some pathology, and they develop a tumor in a solitary kidney situation, and that is where this nephron sparing surgery was initially introduced. And over a period of time, the principle is that the tumor and a small strip of the kidney around the tumor is excised, and the rest of the kidney is repaired using intricate expertise and sutures and technology, so that the remaining part of the kidney would continue to help the patient lead a normal life and not result in chronic renal failure and dialysis. But over a period of time, they realized that the results of these surgeries were improving every single year, year by year, and hence now it is being adapted to any kind of kidney tumor, provided the size, location, and certain parameters are suitable for the safe removal of the tumor with only a margin of the kidney and not the whole kidney. So basically, that is what is the meaning of nephron sparing surgery, where the rest of the kidney, wherever possible, in selected and suitable cases where the size of the tumor and the location of tumor allows us to do it safely, we perform nephron sparing surgeries. And we do quite a few at Manipal Hospital, Goa.
Right.
And the patients have had excellent results.
That's nice. Doctor, have you performed any complex onco or reconstructive surgeries?
Manipal Hospital, Goa is unique because it's probably the only super specialty hospital where it has a excellent panel of super specialty consultants full time and across every single specialty. Onco and reconstructive surgery work is not usually a single department job. It is a multidisciplinary approach where several specialists come together right from day one, where the patient has visited the OPD, the decision making, the planning of the surgery, and the post-operative care is planned in a very systematic and disciplined manner with a proper multidisciplinary team, where we have not only the urologist, we have a vascular surgeon, an oncosurgeon, a reconstructive plastic surgeon, as well as medical and radiation oncology specialists who come together to treat this patient as a whole, and hence we are able to do complex cancer surgeries in lot of patients, and improve their overall outcome and survival to a great extent. Recently, in fact, I would give you an example where a patient, 75-year-old patient, had presented with a large, almost 30 centimeter sarcoma involving his abdomen and pelvis, and which was involving the vessels as well as the left ureter, which is the pipe which connects the kidney to the bladder. So along with me, vascular surgeon, plastic surgeon and oncosurgeon, we successfully removed the entire tumor, reconstructed the ureteric and vascular passages, and the patient had an excellent outcome. We also have a dedicated team of anesthetists with great expertise in all these cases, as well as excellent OT and ward nursing, and a large cadre of dedicated clinical assistants who help us with all these surgeries. Manipal Hospital also has a excellent ICU setup where these patients need to be managed in a very careful and dedicated manner in the post-operative settings, because they usually elderly, have lot of medical comorbidities, and need everyone's support. Kidney transplants, major onco and reconstructive work is always a teamwork, and the unique thing is that all specialists and dedicated staff is available at all times in our hospital, so we are able to deliver excellent results for these patients.
Right. So, Dr. Madhav, we have spoken about complex surgeries and latest advancements in urology, but I think one of the commonest reasons a patient would come to a urologist is a kidney stone. So, I would like to just go back to the basics, and if you could tell us about kidney stones, what exactly is it, and what are the different types of kidney stones a patient could suffer from?
Kidney stones is one of the commonest clinical conditions we manage as a urologist. It forms almost 70% of our practice, and the most important thing is that the patient comes with very, very, very severe pain when there is a stone which is obstructing his passages. Usually the stones are formed in the kidney basically because of improper fluid intake, abnormal diets containing high amounts of shellfish, red meat, alcohols, excess use of milk products and certain vegetables like brinjal, ladyfinger, excess use of tomatoes, cabbage, mushrooms, nuts and milk products, as I said earlier. Now, basically it is precipitation of salts because of excess production of these metabolites or decreased fluid intake. So, the end result is concentration of all these salts, and they deposit in various parts of the kidney. Right. As long as they remain in the kidney, they do not cause much trouble. But as soon as the stone moves down from the kidney into the passage, the ureteric passage which connects the kidney to the urine bladder, that is when it causes an obstruction and very, very severe pain. So patients present with pain, that is the main symptom. Sometimes they present with blood in the urine and infections, and in certain cases if they neglect their symptoms, then they present as emergencies with renal failure and end up in ICU. The diagnosis is based mainly on radiological tests, and CT, ultrasound and CT scan are the main tests which we do to diagnose the conditions. And various treatment options. Initially we treat the pain, infection, make the patient comfortable. In a few cases where the stones are very small, usually less than 5 millimeters or lesser, then we give them conservative treatment. If the pain settles, there is no infection, there are blood reports, serum creatinine is normal, indicating a good renal function, then we send them on medications. And try for the patient to pass out the stone spontaneously. However, patients
for surgery and procedures?
Whenever patients have unrelenting pain, or the blood investigations reveal infection where high blood counts are there is infection in the urine, or the serum creatinine is high, which indicates that the renal function is getting impaired, then mainly in diabetics or hypertensives where the medical condition is getting worse because of the obstruction and pain, then we do not advise conservative treatment.
Right.
And then we go in for various interventions.
Okay, so what are the different interventions that you have for kidney stones? Is it
Yeah.
based on the type of the stone or the
Yeah.
size of the stone?
It now basically in the olden days either it was just conservative treatment or open surgery, but now we no longer do any kind of open surgery for stones. It is always endoscopic or minimally invasive treatment. So we have different methods, as I had mentioned earlier. Small stones with not much of an obstruction, we give just shockwave lithotripsy, which is just external shock waves, electromagnetic shock waves, which are delivered through a ultrasound guided targeting of the kidney on a Dornier lithotripsy machine. Then we do endoscopic interventions using a ureteroscope or a flexible ureterinoscope for and a holmium laser to laserize the stones. And in patients who have very large stones in the kidney, these are called staghorn stones, where the entire uh, major part of the kidney is filled with stones, then we do keyhole surgery. It is called as percutaneous nephrolithotomy or PCNL. That again is now done through very miniature keyholes, very small keyholes using fine endoscopes and lasers and flexible instruments. So has made the process very safe and simple for the patient.
So the recovery is also faster.
Recovery is faster. Patient gets back to work as quickly as possible.
Right. Doctor, what would be your advice to our viewers of how to prevent kidney stones?
Prevention of kidney stones is a multifold strategy. Basically, those patients who are having recurrent stones on both sides, coming repeatedly with colics, they have to undergo a detailed metabolic evaluation where we test the blood as well as a 24-hour urine analysis to find out what exactly is the cause. And we also do stone analysis wherever we have retrieved these stones. And on the basis of this, we put the patient on specific treatment, like if it's oxaluria or high uric acid or phosphate stones or infected stones. Each type of stone has a different treatment modality, which are usually oral medications. But those who do not have any of these metabolic problems on evaluation, then the general instruction is mainly to have good fluid intake, which is usually about 12 glasses a day.
Right.
In hot and humid season, it has to go up to 14 to 15 glasses. Around 2.5 to 3 liters a day would be the ideal water intake. In terms of diet, as I had mentioned earlier, shellfish, prawns, red meats are the main non-vegetarian culprits, and too much of tomatoes, brinjal, ladyfinger, uh, too much of milk products or nuts are also harmful. So alcohol is also in large quantities. They have very high oxalate content and uric acid content, so would have to restrict on that.
Right. So, doctor, before we wind up this episode of Health Mantra, what would be your take-home message to all our viewers?
Take-home message is: do not neglect your symptoms. If you have any kind of urinary symptoms, unusual amount of pain, any blood in urine, any symptoms like weight loss, loss of appetite, bloating, not feeling well, unusual worsening or detection of diabetes or hypertension, then please seek a consultation with a specialist and do a basic set of tests to find out why this is happening. Do not neglect your symptoms and do not do home remedies for whatever symptoms I have highlighted.
Right. Thank you, Dr. Madhav, for taking time out from your busy practice and coming here to the studio and enlightening our viewers about so many different advances in urology. Dr. Madhav Sanzgiri, as I said earlier, is a consultant urologist at Manipal Hospital, Goa. He is available for consultations on all days of the week except Sundays. So, if you have any of problems with regards to urology, feel free to go to Manipal Hospital, Goa for a consultation.
Thank you very much for having me, Stacey. It was my pleasure and a great talk, and hopefully it will benefit our patients to seek treatment early and not have any excessive complications and morbidities.
Yes, sir. Thank you so much for watching this episode of Health Mantra. Don't forget to eat healthy, stay fit, drink lots of water, and keep watching Prudent. Take care.